Good morning. On behalf of all of us here at the Cooper Institute, we welcome you to our Coffee with Cooper virtual series that focuses on taking control of your health and working towards a healthier future. This series presents up-to-date health and wellness information and offers suggestions for healthier living based on proven science. I am Laura Defina, the President and Chief Executive Officer of the Cooper Institute. For those of you who are not familiar with the Cooper Institute, Dr. Kenneth H. Cooper, the father of aerobics, founded this nonprofit in 1970 to promote lifelong health and wellness worldwide through research, education, and advocacy. By improving public health, the Cooper Institute helps people lead longer, better lives now and well into the future. It is my pleasure today to welcome Dr. Tyler Cooper, President and Chief Executive Officer of Cooper Aerobics. He oversees Cooper Aerobics' 7 diverse health and wellness companies, each focusing on fulfilling the Cooper purpose of improving the quality and quantity of the lives we touch, whether it is through preventive medicine, corporate wellness, or fitness and nutrition. Since 2006, Dr. Cooper has been a preventive medicine physician at the Cooper Clinic. He completed his internship in family practice at Riverside Regional Medical Center in Newport News, Virginia, and his preventive medicine residency at the University of South Carolina. Dr. Cooper received his medical degree from the University of Texas at San Antonio and a Master of Public Health in Healthcare Management from the Harvard University. Today, Dr. Cooper will be discussing the importance of fitness in solving America's healthcare crisis. We will have a few minutes at the end for him to answer the questions you submitted ahead of time. Also, you have the option to use the Q&A function to submit questions while he's talking, so please feel free to do that. And at that, I would like to introduce Dr. Tyler Cooper.
Well, good morning, everyone, and thank you, Dr. Defina, for that introduction. It's a pleasure to be with you all today. I know we're scattered across the country, so it's a neat chance that we can come together virtually here. I can tell you it's a beautiful day here in Dallas, and I hope it is where you are as well. But as Dr. Defina mentioned, the purpose today is to show how fitness, in fact, is the answer to the healthcare crisis in the United States. But just to reiterate what we are and what we do as an organization, our objective is, of all the lives that we touch through the different means and mechanisms that we have here at Cooper, is to improve the quality and the quantity of a person's life. But before we dig into that, let's start with what is the healthcare crisis in America today. And if you go back to the 1960s, if you look at our gross domestic product, our percentage of expenditure on healthcare at that time was only 5.2%. You can see on this chart as how it's escalated over the years now. In 1980, 9%, 2000, almost 14%. Now 2019 and where we are today, probably closer to 18% of our GDP. Well, you would say, maybe you're not an economist, but you say, well, can't that just keep going up as the need demands? And the reality is that that can't, not only because of the fact that more and more people are sick, but we don't have the capacity, the financial dollars to meet the need, meaning there's not enough infrastructure, there's not enough hospitals, there's not enough doctors and so forth. And what happens at that point is you start seeing care giving to the haves and the have-nots. And it's going to be based more on an economic basis rather than a healthcare need. So this is a very, very serious problem that we're facing as a country. And you look at what those percentages actually mean in real dollars. If we can get the next slide. This isn't, sorry, everyone. The next slide to pop up. It's frozen. And as we're doing that, I can tell you, there we go, thank you. That in 1960, and these are in billions, that we only had less, maybe only a few $1 billion in healthcare expenditures up to 2013 on this graph, and even beyond today, we're spending almost $4 trillion a year in healthcare expenditures. A massive amount of our GDP and our total spending. And so as you think about that, you think, well, at least we're getting a return on our investment, right? That we're going to have the healthiest country and the happiest people in the world. In actuality, what we find is that we rank 34th, this varies a little bit, in longevity, that all these countries, Japan, Australia, Spain, France, Lebanon, all live longer than we do as a country. And then you look at, again, their spending of GDP relevant to healthcare. Lebanon spends 6%, they're ahead of us. Japan spends only 9%, and they're the longest living. But you look at quality of life factors as well, and you can see we're only number 17. Multiple factors go into what it means to have quality of life, but relevant, again, to the Cooper goal of extending length and quality of life, the medical system as it works today does not appear to be answering that question based off of the statistics. So how is that money that we're spending, that almost $4 trillion that we're spending on healthcare, where is it going? And almost 40% of it is going to hospital care. Now, we know that most of the times when you go to the hospital, it's because you are ill. It's not done for preventive purposes, like all the things that we do here at Cooper that are preventive based. 40% almost is spent on things that are related to illness, not to prevention. And what I'm going to show you is a lot of that illness, again, is associated with things that can be prevented by preventing chronic disease. Other things that you look at, almost 10% spent on prescription drugs. I want you to notice that as well, because that'll be an important point in the following slide. So what does that mean to the individual as far as healthcare spending? How much are we as individuals playing a role in those healthcare spending in dollars? And so these are general averages based on insurance expenditures. You look at an average family who has company-sponsored insurance programs, they're going to spend with the company almost $21,000 a year. An individual with a company-sponsored program, again, collectively, the two together are going to spend almost $7,000. And in most of the cases, that doesn't include the deductible that's coming out of the employee's pocket. For a family, $6,400 additionally, $3,200 for an individual. So some of us that may not be a lot of money, to some of us may be a ton of money. And so let's look at it from a perspective in that sense. An average person, an individual making $50,000 a year, they're looking at $5,200 a year approximately that they're going to be spending on healthcare. Again, some of them will have deductibles that even raise that higher. And of that, an additional $5,500 is going to be spent by the company for a total. But if they have to go outside of the company, that individual, again, they're making $50,000 a year, they're going to be looking at spending almost over $10,000 of that income trying to buy insurance for themselves. You look at it from the perspective of a family of four on $100,000 a year, what we would consider a good salary. 12% of that, if they're all healthy, is going to be spent on healthcare. Okay, then you're going to take taxes out of that, cost of living expenses. It is an enormous amount of money that's coming out of an individual's pocket just to have the insurance. And if one of their family gets sick, that expenditure goes up to about 15%. And if they're not sponsored by an organization, by a company, they're going to be looking at 20% as a family, $20,000 trying to cover their healthcare needs. And whether or not that's good healthcare or not, again, depends on a multitude of factors. So very, very punitive almost to an individual to even try to maintain healthcare to keep themselves well. So what's driving the cost of these burgeoning cost of healthcare in our country? And no surprise to many of you, I'm sure, is that much of it is going to be related around chronic disease primarily starting with the cause of obesity. A CDC report here where you can see this graphic, the schematic, where you're looking at the rate of obesity levels in our country by state from 1990 to 2000, 2010. If you look at 1990, most of the country was at worst 10 to 14% of the population being overweight or obese. By 2000, that jumped to half of the country being between 20 and 24%. By 2010, you had probably 10 states that were greater than 30%. Moving on in 2017, they keep having to change the colors because of what we're doing as a country. And you can see half the country is between over 30%, with multiple states over 35%. You go on to 2019 and wow, you look at that, 10, 15 states, over 35% obese. Obese being defined as a BMI greater than 30. Admittedly, BMI is not the best way to measure it, but on large scale purposes, from a utilitarian perspective, it makes the most sense. Either way, we know we have a problem. All you have to do is walk outside to a mall or anywhere, go to a hospital and see the amount of obesity. Okay. And so what are the trends of obesity? Again, we have a third of our population at least that's obese, 2/3 that are overweight or obese. Well, how do we get there? And honestly, it's not rocket science. We're not exercising as much and we're eating more. In 1970, the average American down around 2,100 calories a day. By 2008, it was up to close to 2,700, a 23% increase. And why is that number so important? Because we know that there's 500 calories or 3,500 calories in a pound of fat. So if you're eating an extra 500 calories a day, you can expect to gain approximately a pound per week. I imagine to now that number is even higher. I don't know what it is, but I imagine it's probably closer to 3,000. We are eating ourselves into this problem. It's not something beyond that. Now, there's a multitude of reasons why we're doing that, but it is a choice. At the end of the day, the calories we consume every day is a choice, and it's having a massive public health effect. But okay, so we're heavier, big deal, right? Well, in fact, it is a big deal. We know that obesity specifically correlates to your risk of cancer and multitude of types of cancers. You can see here, based off BMIs, the risk of cancer for men and women going up as your body mass index goes up. So this is, we know, again, that obesity is causing cancer. What types of cancer? Again, you can see the graph here, the increase in risk relative to body mass index, the greatest being endometrial cancer, then esophageal cancer, kidney, colon, breast, pancreas, other types of cancer as well. So, and that is on a linear curve, that the higher your BMI, the higher the risk of developing these types of cancers. And so you look at someone under 25 BMI, and you look at that significant multiple increased risk, example, in endometrial cancer. And we wonder why our healthcare expenditures are going up, because cancers, as we know, as horrific as they are also extremely expensive and not always effective, unfortunately. So what is the financial cost of obesity? What does it actually relate to in dollars? We know that obesity is related to chronic disease, and we know that chronic disease causes approximately 7 of the 10 deaths that we experience in this country every year could be prevented by preventing chronic disease. And of that expenditure, of the approximate $3.6 trillion spent, United States estimations of 2.7 trillion of that are related to chronic disease, obesity-related problems. If we could pull our obesity down to even a fraction of what it is now, you see a tremendous gain in dollar savings. And just on an individualized basis, they estimate that an obese person, it costs them $1,500 more a year on their health care. Okay. And that's a significant impact, and certainly someone making the kind of money we were showing earlier. Well, what does obesity lead to? We all know that it leads to diabetes, right? And so here we see an increase in the trend of diabetes, again, reported by the CDC, where in 1994, most of the country was less than 4.5% of their population was obese. By 2013, the majority of the country was greater than 9%. By 2017, we have multiple states in the middle teens, as West Virginia being at 15.2%, and a large portion of the country being greater than 10%. Okay, well, again, why does that matter? Because it has a tremendous impact on chronic disease and associated problems. Here's a list of things that you can see that diabetes are directly correlated to: increased risk of cardiovascular disease, cerebral vascular disease, kidney failure, eye problems, neuropathies. Not only these horrible diseases that cost a lot, but again, they dramatically impact the quality and the quantity of the life. And I just want to reiterate the fact that that's what we're trying to help people do, is to take their health, to make it their own responsibility to improve the quality and the quantity. And in doing that for themselves, you're going to see that that has a tremendous impact on us as a population. What does diabetes do with cost? Again, no surprise, an enormous amount of money, $404 billion a year in 2019. Again, 60% of that being paid through tax dollars. So we're paying for it. Even if you're not overweight or obese, you're absolutely contributing to the cost of it relevant to the need. What about dementia? Many of you I know have concerns about dementia, as I noted in the questions that I received. And right now, the estimation, and this is dementia in whole, not necessarily in part of Alzheimer's or different types, but in whole, we're looking at about 5.2 million people in the population at 2014, with an estimation of that growing to 16 million by 2050. And again, look at the exorbitant cost that goes into that as well, 150 billion to 800 billion. Not to mention, again, the loss of quality of life that's conducted in here. What about COVID? Obviously a huge part of our society today. To date, as of September, we've had almost 43 million cases of COVID in the United States. with pushing 700,000 deaths. They estimate that at least since January, and this is a difficult estimation, but maybe 2 million people have been hospitalized because of COVID. And even more so, that the people who survive, that 1 in 20 of them are going to experience symptoms of long COVID, meaning that they have multitude of different types of symptomatology, negative symptomatology that lasts for greater than 12 weeks. And that's still a big question mark. We don't know how that's going to continue or persist, but a major problem, which is going to be associated with cost and, again, decrease in quality of life. Again, no surprise, the risk of COVID is directly related to chronic diseases and age. We know that 95% of the deaths are in people 45 years and older. And that certainly has to relate to the fact that chronic disease has time at that point to have taken hold in someone of that age. Cancer, diabetes, heart disease, overweight, obesity, smoking, tobacco, all directly related with a worse outcome with a COVID infection at a significant level. In fact, we know that the 2 biggest risk factors for death if you get COVID is being over the age of 65 and being obese. Obesity is higher than all those other ones. So again, something that is controllable. And I understand it's not easy necessarily to lose weight, but what we're going to show you here is the effort matters on the good news side of this presentation, which we'll get to shortly. Age directly, obviously related to COVID hospitalizations. You can see the older you are, the more likely that you will get hospitalized. No surprise there, but again, that correlates again along the lines of chronic disease having time to take a foothold in your life as you age. What is the cost on us as an economy because of COVID? Estimation from a Harvard study showed that by the fall of 2021, the estimation spending would be at $16 trillion, with half of that being in lost GDP. But you can see the health-related associated cost, and we can see the effect of our GDP in this country specifically related to COVID, as in the first time since 2010, we've seen a reduction in our GDP. We're hoping that in the next year that it will improve. So what is the solution to this problem? Well, obviously, lots of discouraging statistics. Oh goodness, what are we going to do? Well, the good news is that there is an answer, and there's something that you as an individual can actually do about it. And it's 2 things. It's exercise and it's prevention. And as we get into that, we start with, well, how does Cooper even exist? Why do we do the things we do? It goes back to 1968 when my father published his first book, called Aerobics. And his hypothesis, his crazy hypothesis at the time, crazy to think about now, was to prove that exercise actually had a beneficial effect on your health. I remember in the early days seeing articles in the paper that said my father was going to kill more people than Hitler by promoting running, that there are going to be millions of dead joggers around the world as my father promotes exercise. But in fact, at the time, there was no science that proved the beneficial effects of exercise. And so what he did, like in any hypothesis, you first have to come up with a test to measure something in order to manage it. And so he, as you can see in that early picture there, started measuring fitness by time on a treadmill stress test as a prediction, or this is an actual VO2, but eventually a prediction of VO2. And when he left the Air Force in 1970 and started our facility here at Cooper Aerobics and Cooper Clinic, as part of the Cooper Clinic for the last 51 years, when you come through a physical evaluation here, which I imagine many of you on this call have, you know that you're going to go through the dreaded treadmill stress test. And for those of you who haven't been through it, what it is it's 3.3 miles an hour. It's going up approximately 1 minute degree. And you go as long as you can. As I like to say, no one's ever beat the treadmill. It's 100 and 0. It's never lost. But again, the objective of it is based off specific your age and gender. It is specific to your age and gender in 5-year segments. It's going to classify your predicted VO2 into one of 6 categories and 1 out of 100 percentage. And what's so important about this is this relates to the published data. So that very poor category, I want you to think that's what it means to be unfit. That is the definition of unfit, being in the bottom 20th percentile of fitness as measured by your time on the treadmill stress test, relevant to your age and gender. We've been doing this for 51 years, and all that information that's collected here in the Cooper Clinic has been contributed to the Cooper Institute to create the database and the studies that the Institute's been doing such a wonderful job of for almost over 50 years. That represents 326,000 records, 116,000 individuals, and 2.2 million years of life. Every one of those individuals, pretty much we have a fitness test on with 3,000 other variables of their health. Again, things like blood pressure, cholesterol, a multitude of things that's all collected. So it's the largest database in the world of its type, and it has changed the world. The research that has come out of the Institute has changed the world, with the most impactful, arguably, article coming out in 1989. That was the first definitive article that ever showed the physiological benefits of exercise. Prior to this time, our thought, my father's thought specifically, was that more exercise was better, meaning that if you could run a mile versus 5 miles versus a marathon, the marathoner is going to have the best quality and quantity of life. But in fact, what we found that was so unique about this study was that just getting out of that bottom category of fitness, again, as I described, as the bottom 20th percentile, relevant to your age and gender, would extend your life by 6 years and decrease your risk of dying of any cause by 58%. But as you moved into those next categories of fitness, you didn't get that much more benefit. And so this is the big misnomer in our society today, as it is, in order to be fit, you have to be like the people you see on TV that are 25 years old, no body fat, running around the hills of San Francisco. That's what it means to be fit. That is not what it means to be fit. What it means to be fit is cardiovascularly out of the bottom category of fitness for someone your age. Is it ever too late to get fit? This is a published study in 1995 in JAMA. It's never too late to get fit. Good news. People who stay fit throughout their life, again, as I've defined it, are going to have the least risk of all-cause mortality. But people who are unfit become fit in their life have much less risk of mortality as compared to those who stay unfit throughout their life. It's never too late. What about cancer? We know that, again, cancer drops precipitously with your level of fitness. Lung cancer, colon cancer, as you can see on the graph here. Why does prostate cancer go up? Many of you probably know that prostate cancer is a cancer that's typically diagnosed later in life. And so, in fact, you're living long enough to get COVID or get prostate cancer, if you will. But we do know that it decreases the risk of cancer in most types of cancer. Diabetes, we talked about the horrible effects of diabetes. We absolutely know, again, a precipitous drop in the risk of diabetes relevant to your level of fitness as I've described it. Again, you see the biggest drop, the biggest bang for your buck, just getting out of that bottom category of fitness. What about dementia? Dementia is more linear. The more fit you are, the less likely you are to have dementia. And I can tell you, my father, 90 years of age, still working here, seeing patients, exercises every day. The reason that he has been able to sustain his life and is scoring off the curve, as we'll mention, as we talked about here in a bit, is that he is consistent. He's not a zealot in anything, but he is consistent in his diet, his exercise, his weight, and his continuation of studying. He continues to exercise his brain. You should never stop learning. Doesn't matter what you're learning necessarily, but you should never stop learning. We know it's one of the most important things that you can do to prevent dementia in conjunction with a regular exercise program. And also, my father would say that his faith is important because it gives him a purpose. You have to have a purpose in your existence. Those are the things that when people ask me, how's your dad done it? I've seen him do it consistently for 50 years. What about Parkinson's disease? I know there's some questions about Parkinson's. The gentleman in this picture here is actually the former president of the Cooper Institute. He worked for us for many, many years. Later was diagnosed with Parkinson's. And knowing everything that he knew about exercise, he started a movement disorder class in the Cooper Fitness Center, because we know that fitness, we can't prevent or we can't ultimately cure Parkinson's, but we can absolutely decrease the risk of this symptomatology. Exercise improves the movement, memory, sleep, balance, endurance, as well as decreasing the risk of fall, freezing gait, depression, anxiety. It is one of the most important things you can do with movement disorders. What about COVID? Exercise with COVID. We certainly know exercise decreases chronic disease, which consequently decreases the risk of severity of COVID. We also know that exercise boosts your immune system, prevents weight gain, prevents chronic disease, reduces stress, anxiety, and improves sleep. Dramatic impact there. So we thought a lot about quantity of life, disease. What about quality of life? Does exercise make you feel better? And in fact, we do know that as well, that if you look at these symptoms, fatigue, heartburn, impotence, low back pain, depression, headaches, difficulty sleep, we know that all of those go down as you get into the higher levels of fitness. Again, the biggest bang getting out of the low category fitness. Going back to what I mentioned earlier, about 9% of our healthcare spending on prescription drugs. Think about, I know as a doctor, but think about all the prescriptions that are prescribed relevant to those specific symptoms. A way, again, to decrease the healthcare crisis by decreasing the need. The only way we're going to solve this crisis is by decreasing the need for healthcare, and there's a very simple solution. What about fitness and healthcare costs directly? This is a study by the Cooper Institute again, several years ago, where we looked at Medicare spending for someone who was fit in their midlife, and then checked it again during their Medicare years. No surprise, we saw a almost half drop in the amount of Medicare dollars spent relevant strictly alone to fitness. Life-changing results here that we should be paying attention to as a country in order to solve this problem that we're all in together. We did that as well with our organization here. I did a study where we measured the fitness levels of our employees and correlated it against their healthcare claims. Again, it's that stair-step drop that the people who are very poor in poor categories of fitness or don't even participate, in my specific situation as our organization here, cost us 5 times more than people who are fair all the way up to superior. There is an absolute correlation with healthcare expenditures and financial expenditures, and fitness. But again, fitness as we are describing it, not running marathons, not that that's necessarily bad, but point being is it doesn't take much to be fit. That's the message that needs to be heard. So if there is a magic pill ever been out there, it is fitness, okay? And again, fitness meaning, I'm gonna describe what that means in more detail here in a moment, but being fit in the sense of being out of the bottom category fitness. But what about, and how are we doing that? What's our goal as an organization to get that out? You know, certainly not everybody can come to the Cooper Clinic and go through a treadmill stress test. And so one of the projects that we're working on right now is to put fitness testing through a basic walk test or run test in doctors' offices around the country so that doctors can begin to give a patient a fitness result as if they came through the Cooper Clinic. It's a project we're really excited about and hopeful to be launching as we work to try to solve the healthcare crisis by putting the information in the hands of doctors who can help create change in the patients. But what about our kids? Certainly we know there's obesity crisis in our kids. Similar statistics here with the CDC. As you can see, back in 2003, most of the country less than 10%, 10 to 14 at worst. 2013, 17, you can see it going up. By 2017, 15 to 22% of the population of kids. Okay, why is this? No Child Left Behind took PE out of school in the hopes that it would increase grades, right? And performance on standardized achievement. And so I'll show you why that's actually exactly opposite of what you should do based off institute-related data. The fast food generation, this is a scary statistic, but 85 million Americans is estimated to eat fast food every day. 36.3% of the American kids eat fast food daily. And they're not eating healthy food at fast food the vast majority of the time. As well, there's lack of physical activity. Only 1 in 3 kids are physically active every day. And teens spend up to 9 hours a day on the screen. Terrible for them in a multitude of different levels. So what should kids do? They should spend at least 60 minutes exercising a day. It's estimated that should be 30 minutes at recess or PE in school with another 30 minutes playing at home. We estimate that only half of the children in America get that. So what has the Institute done over the years? Back in the 80s, they created FitnessGram, which is a measurement of a child's level of fitness, not their athletic ability, based off these different metrics, these six or seven different metrics. And what you can see is that, in fact, based off how many of these fitness metrics that they could pass, their academic achievement went up linearly. So that the kids who could pass all 6 had the highest math score standardized achievements. They had the highest English scores as well. And it even with socioeconomic status, when you look at kids who are getting their lunches at school on a lunch program versus kids who are getting it from home, obviously representing their ability with financial means, there's certainly a great disparity there. But even kids who are having to get their meals at home, the more fit they are, the better they're going to do on standardized achievement. We know that fitness changes kids' lives. It makes them perform better academically. And so if anything, we should put in more fitness back into the schools than less. Certainly, violence is a problem in our society today. We know that the more fit you are, the less violent you are. Again, wonderful studies that have been produced. So what do we recommend for children? 8 hours of sleep minimum, 5 servings of fruits and vegetables a day, 3 servings of low-fat products, less than 2 hours of screen time. And I have 3 kids and I work hard on getting them, make sure they do that. It's not always easy. An hour of exercise daily, as I mentioned, and then avoiding sugary drinks and highly sweetened foods. So again, how does this come back to you? How does this impact your life specifically? What should you be doing? And again, the goal is to square off the curve, as I mentioned earlier, with my dad's 90 years, what we want it to look like. Live it life up the last moment. One day you just don't wake up having been able to live life the way you wanted to live it. The best chance of you achieving that goal is through following the 8 steps of getting Cooperized. The first being maintaining a healthy body weight. A BMI ideally below 25, but more importantly, if you can get a % body fat measure, you'll have a more accurate prediction of your goal. How do you do that? Our goal is to lose 1 to 2 pounds per week, not some crazy diet. And that's through 3,500 calories and a pound of fat, as I mentioned earlier. Know your RMR, your resting metabolic rate. All of a sudden, then your fitness or your ability to lose weight becomes math. Resting metabolic rate is how many calories you're burning at rest, and then you can know with your activity on top of that how much you have to eat a day to lose weight. It becomes much more of a math problem than a psychological problem. Types of food, 80-20 rule. 80% of the time you're eating quality foods, 20% of the time loosen it up a little bit. You got to enjoy your life some. And daily you should be looking for 5 to 9 servings of fruits and vegetables. A healthy eating plate through Harvard looks like this. You can see most of it vegetables and healthy proteins with some whole grains and fruits. Exercise. What do we mean by exercise? 30 minutes of cardiovascular exercise a day. Okay, I tell my patients, I don't care what type of cardiovascular exercise you do, as long as you're achieving that objective. 30 minutes, ideally at least 5 times a week, starting out if you're not used to it, building up to that over time. What about the intensity level of that? Should be 70 to that of the 30 minutes, 20 to 25 minutes should be in your target heart rate zone, which is 70 to 85% of your predicted max. Predicted max is 220 minus your age or 205 minus half your age. There's plenty of calculators on the internet. You can find that. And muscle strength training, extremely important as you age. We naturally lose bone and muscle as we age. And so it is incredibly important for muscle strength training to maintain that for a multitude of reasons to both quality and quantity of life. But again, there's no preference as to what type of cardio you're getting as long as you're getting it. Vitamins, we've done a lot of research on vitamins. This is our vitamin line that helps support that research. I know if you heard my father's presentation a few months ago, he talked a lot about vitamin D and inflammation. We're doing a lot of research on that now, but we know that the basic multivitamin fish oil can lower the rate of oxidation of LDL cholesterol and inflammatory markers of C-reactive protein. What that does, it makes the cholesterol less sticky, less likely to build into arterial plaque. And so that could be a whole lecture by itself, but it's certainly important. But I want to reiterate, it's a supplement by definition. It is not in lieu of a healthy lifestyle. It is a supplement to a healthy lifestyle. I always joke, and somewhat serious, if you're smoking, you're just not smart. Because in fact, everybody knows the dangers of smoking. But what's interesting, what most people don't know is that being unfit is as dangerous as smoking, relevant to your quality and quantity of life. I understand that it's a very addictive habit. I help patients with it regularly. Try to stop. It matters. It's associated with a multitude of types of cancers that you can see here. And it's never too late to stop smoking. You can see here that just even after 15 years, it's from a heart disease perspective, it's equivalent to as if you never smoked. But you get benefit even 20 minutes after quitting. It's never too late to stop. Alcohol, we know that more than 7 drinks a week and more than 1 to 2 in a day can have a dramatic impact on your life. A recent study actually showed that if you drink more than 5 drinks a week, it can take 2 years off your life. And it causes cancer as well. Most people don't realize that alcohol causes cancer, a multitude of types of cancer, as you can see here. And just to be clear, this is not a drink. My doctor said only 1 glass of alcohol a day. I can live with that. In fact, a drink is 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. Again, lots of people struggle with this because of the addictive nature with it, but it is important, relevant to the quality of your quantity of life. You can enjoy it within moderation, but beyond that, you are damaging yourself, and you have to ask yourself, why am I doing this if I know I'm hurting myself? Stress, certainly through COVID, has been a huge problem, but even before that, it was a problem, as this is a graphic here of the increased use of antidepressants, anti-analytics over the last, going back from 1999 to 2015. And in the last year, I saw an estimation that almost 30% of our population is struggling with anxiety or depression. But these are actually people using medications for it. Okay, we're not becoming healthier, and we're not becoming healthier as a country and as a population based primarily on our choices. And so you have to change the choices in your own life from a grassroots effect to create population change. Knowing your numbers, certainly here at the Cooper Clinic, we promote knowing your numbers so that you can actually do something about them. Things that we check. Number 1, your fitness level, as I mentioned, laboratory data, basic laboratory data, blood pressure, body fat, knowing calcification score, what's your risk for heart disease, colonoscopy, skin cancer, all things that are involved in a Cooper Clinic evaluation, which allow us to prevent them from occurring. Our goal is what we call primary prevention, preventing it from ever occurring to begin with through the lifestyle choices that you're making, or at least if we find it, catching it early. That's the whole focus of our type of practice, which we wish we saw more prevalent throughout our country. And just as a last point here, it's never too late to start. This was a gentleman who came to us in 2000. He weighed 538 pounds. He was 38 years of age. And in 2 years, he lost 230 pounds through diet and weight alone. No surgery. I'm not necessarily against surgery, but he did it through strictly doing what we're talking about, diet and exercise. And I'm glad to say that now he's been able to keep it off. These are all the good things that happened to him. He and I back running a half marathon together in a pretty good time for a guy who used to weigh 538 pounds there at 148. And then a few years ago, to celebrate him keeping the weight off, we went and ran the New York Marathon together. My point being is it is never too late to start, and never think that the hill is too great to climb. It is not. You just have to have the self-discipline and the motivation and the encouragement and the support and the knowledge to help yourself achieve that goal. And another inspiring story, this is Orville Rogers, who was a longtime supporter of ours and supporter of the Cooper Institute. He died a few years ago at the age of 101, but prior to that, at age 90, he decided, you know what, I haven't done enough with my life. I'm going to be a competitive track and field athlete. And so at 90, he started competing in competitive track and field and set a multitude of world records along the way until he ultimately died at 101 with still a good quality of life up to that point. So again, it's about the length of life. It's about the quality of those years. And I just say that to say, here's my father and I in Antarctica a few years ago, him in his mid 80s here, still getting to explore the world and have a wonderful time as father and son, living our lives to the fullest. And that is my hope and my prayer for you, that this information will help you on your goal to improve both the quality and the quantity of your life. And in doing that, we're going to help our country and we're going to help our world in where there is so much need. Thank you for your time. And with that, I will turn it back over to Dr. DeFina.
Thank you, Tyler. That was just an excellent talk. And I always love this picture of you and your dad in Antarctica. First, I really want to thank you for your dedication in helping us to improve our quality and quantity of life. I will tell you, you got a lot of excellent questions, but in the interest of time, I'm going to focus on one thing. Several people asked about fitness and aging. And so if you have someone who is focused on fitness, is really trying to be an athlete as they age, but again, doing it in reasonable amounts, do they expect their fitness to increase as their age increases?
Right. That's a great question. And so you have to think about fitness again in different mechanisms. If you think about fitness again, the way I described it, relevant to your age and gender, if you're an 80-year-old male, your VO2 is not going to be as high as a 40-year-old male. We all know how this story ends. No one gets out of this alive, right? But what we do know is relevant to your age and gender, as that VO2 goes down, it still correlates to all the physiological benefits. So no, you're not going to be able to run a 5K at age 30 as fast as you ran then at age 60. But relevant to the quality and quantity of life factors that I discussed in this presentation, if you can just keep your fitness level out of that bottom category, you're going to see all those benefits to your health. And so what I would tell you is, independent of age and gender, the 30 minutes 5 times a week of a basic level of exercise stands pat for everybody. Orville Rogers, who I showed you there, he was at 90. Obviously, he's not running that fast when he's setting these world records, but it was consistency in the exercise that allowed him to do that. So independent of your age, you still should be getting 30 minutes of cardiovascular exercise 5 times a week. And as you calculate that percentage of heart rate, because your maximum heart rate goes down as you age, the percentage, the 70 to 85% zone that you're in is consequently going to go down as well, indicating that your intensity level is going down relevant to someone who's 20 years younger than you. But again, the summation of that is everybody needs to be doing the same amount of exercise on a weekly basis to get the scientifically proven benefits.
Perfect. You answered the second question, which was, what are my exercise requirements as I age? So I want to ask one last question in the interest of time, but it's really an important question. You know, we've talked to the individual, but you made the point that we do public health here at Cooper. And so the work that you all are doing is trying to get the individual, but also the society to exercise more. What ideas do you have that are going to help get this message out and get everyone exercising? And I think you touched on it with fitness assessment and exercise as medicine.
Right. If you could give me a magic wand and I could do anything to solve the healthcare crisis in America, if I could move a majority of our population, independent of any other factor, weight, chronic disease, otherwise, if I could just move a majority of that population out of the bottom category of fitness, we would not have a healthcare crisis in this in this country. And so how do we do that? You have to first, because unless you've come to the Cooper Clinic, if I walk up to someone on the street and I ask them, hey, are you fit? They're going to tell me maybe how much they work out or what they used to do in high school or whatever it is. They don't know. As opposed to I ask them what their cholesterol was. Well, yeah, I saw the doctor. My cholesterol was 190 or whatever. And so what we're trying to do is give doctors the ability to take this incredibly valuable piece of information that we collect here at the Cooper Clinic and put it into their annual exams. And that's why we're creating these fitness facilities where imagine that you go to your doctor for your annual exam and they send you down the hall for your lab study. Well, they're also going to send you down the hall for a brief fitness evaluation, which is either walking a mile as fast as you can or running for 12 minutes. And these are scientifically proven studies that have high R-value correlations to actual VO2. And then we take that information, we correlate it against our tables on treadmill stress testing here. And the patient, again, they get a result as if they just came through the Cooper Clinic. So I'm a 50-year-old male. I get this test, I get this report, says, hey, you're at the 60th percentile of fitness. That goes to my doctor. My doctor says, hey, you're out of the bottom category. Whatever you're doing, keep it up. If they're below the bottom category, then that doctor has one of our programs, a walking program that can get them started. And then they're going to be retested in 12 weeks. We know that people listen to their doctor more than anybody when it comes to creating change, behavior change. And so our objective is to give this incredibly valuable piece of information, put it into the hands of the doctor without putting a whole lot of onus of work on the primary care doctor, but allowing them to actually measure their fitness as a vital sign. Interestingly enough, as I mentioned, my father back in the 70s being, just completely ostracized and threatened for his beliefs in fitness as an important value or fitness, a vital sign of health. Now, as I showed in that slide, by 2016, the American Heart Association, in conjunction with the Cooper Institute and our data, is publishing fitness should be measured as a vital sign. Again, it hasn't been done because it's not easy. And so that is the hurdle that we feel like we have a capacity to overcome, which hopefully insurance eventually will cover that in a way that it will be a standardized evaluation for an annual physical exam throughout the world. And if we can do that, I have complete confidence that from a grassroots perspective, we are going to solve the healthcare crisis in America. But it takes people believing in that. The science is there. It just takes people having the courage to say, I want to know what my fitness is. I'm going to set very basic goals for myself to improve it. And in time, we're going to see success.
Excellent. Well, Tyler, thank you so much. That was absolutely a fabulous presentation. We learned so much and we know what we need to do both as a nation and as healthcare providers. To close today, I'd like to invite everyone that's on the session to join our next Coffee with Cooper on Thursday, November 16th at 10 a.m. with Dr. Cameron Nelson, who's the President and Chief Executive Officer of the Cooper Clinic. Dr. Nelson will be talking about diabetes and pre-diabetes, a healthcare epidemic. What are the prevention strategies? I also want to note that this session will be posted on the Cooper Institute website in case you missed any of the points and you're interested in seeing it again. Again, Dr. Cooper, thank you on behalf of the Cooper Institute. Your presentation was very enjoyable and educational. Thank you so much. And thank you to all of you who came and joined us.
Thanks, everybody.
Bye.